So the last presentation for the day is a presentation from one of the Therapeutic Guidelines senior editors, Hazel Moore. So Hazel's just going to do a quick presentation on what's next for the Therapeutic Guidelines.
Thanks everyone. Pleasure to be here. Can those up the back hear me okay? Excellent, love it. All right. So yes, today I just wanted to talk a bit about what's next for the guidelines, which is our content that's in the pipelines, which Jess touched on in her introductory presentation earlier. And also what might be next for you guys, our ID community, our researchers out there, by giving an overview of the evidence gaps that we've published alongside the guideline. So again, sorry, probably a bit small for those up the back. But as we've seen from all the presenters and panel members today, we've come such a long way from when the antibiotic update first started. But we do still have 3 expert groups working on content that will be published down the track. So topics reviewed by our surgical, trauma and perinatal infections group are listed in that first column. And those topics will be next off the bat. And this group is one of the biggest we've had. In fact, I think it is the biggest expert group we've had. It's composed of a core group of ID physicians, clinical microbiologists and pharmacists, but it also includes an anaesthetist, 12 ID physicians, clinical microbiologists, already said that one, a gynecologist, an obstetrician, a GP and a cardiologist, and they're providing input relevant to their expertise.
And 12 surgeons.
I didn't read that bit, I'm so sorry. Thank you.
I don't know if it's about...
Yes, 12 surgeons, yeah. And all the expert group meetings have been completed and content is undergoing finalisation, and we do expect to publish these topics later this year. Now the other 2 groups, so because of the subspecialist nature of prescribing for patients with immune compromise and in tropical medicine, we do have 2 uniquely composed groups for these topics. So the immune compromised group includes a haematologist, a kidney transplant physician, a respiratory physician and an oncologist, in addition to that core group of ID micro pharmacists. So the immune compromised expert group, they reviewed their first round of topics in February, and we expect to publish this content in 2026. And lastly, the tropical medicine group, last but not least. This includes clinicians with clinical and research interests in tropical medicine and other rare diseases. And the experts bring a wealth of practical experience as they predominantly practice in Northern Australia, spanning Northern Territory, the top end of Queensland and Western Australia. And their first round of topic reviews started mid-March, and we do expect to publish these in 2026 as well. So that's our work. What about you? So what I wanted to do was give a bit of an explanation of the evidence gaps that we've published alongside the antibiotic update. I've blurted out deliberately, your eyes aren't going tired. So evidence gaps, they are often noted during the development of a guideline update, and many of the presenters today have touched on the difficulties in writing recommendations for the guidelines when evidence is difficult to interpret or frankly just not there. So in a desire to support the research community and to avoid a duplication of effort, we piloted a new approach during the Antibiotic 17 update, where we documented, collated and published a list of the key evidence gaps noted during review of the content. So the evidence gaps identify areas warranting further research. They tended to be either where evidence was lacking, Others describe where evidence was insufficient. For example, we might have retrospective or observational data, and prospective or randomised controlled trials would increase the level of certainty in the evidence. And we have also published some gaps where existing evidence is conflicting, and further or better quality evidence could help to clarify the data. So you're probably wanting to know how we came up with the list of the evidence gaps. As I touched on before, the evidence gaps were collected and documented in synergy with our usual process of updating the guidelines. So I thought I'd just touch on a little bit of what that entails. So to inform their topic updates, we do ask experts to search and review the evidence since the topic was last updated. So in this case, it goes back to January 2018. Often other sources of evidence are also considered, like clinical practice guidelines, resistance data, and we've heard a lot about UCAST and CLSI dosing as well today. So following this, the changes to the content are proposed, and these draft topic updates are circulated to the whole expert group. Now, just a quick aside here, our expert groups always include representatives of the users of the guidelines, such as GPs, pharmacists, ED physicians, sometimes intensivists and others, like all of the surgeons on the surgical prophylaxis group. And so when the evidence is interrogated at the expert group meetings, it's the meeting discussion is just so valuable because our expert group doesn't just consider the evidence, but they also get input from our user representatives. And this multidisciplinary collaboration brings in the lens to answer questions that our guideline users really need the answers to. So in other words, the practical application of the available evidence in the Australian healthcare landscape. So the expert groups tried to highlight evidence gaps where evidence could be generated and that evidence would change guideline recommendations. But it is a new process, and we'd like to highlight that the gaps published may not reflect every gap in the evidence. So what were they? Emily Tucker's presentation on pneumonia touched quite a lot on optimal duration of antimicrobial therapy. That's an area where we do have a fair amount of evidence, but in many infections, either the evidence is there, but it's difficult to interpret for all patient groups, or it's just those questions haven't been answered at all. So yeah, the most common was optimal duration of antimicrobial therapy, followed by a close second, which was the optimal duration of IV therapy if it's needed, before swapping to oral therapy. So the other evidence gaps are grouped according to the topics in the antibiotic guidelines. They're not listed in order of research priority. So our expert groups, they're pretty expert in identifying the gaps that would influence the guideline recommendations, but prioritising the evidence gaps is another skill set entirely, so we didn't think that we were the right people to do that work. So I thought it might be useful to illustrate what goes into the development of an evidence gap with an example. This one, the optimal choice of antibiotic regimen for non-operative treatment of acute uncomplicated appendicitis. So there's a bit to unpack there. So for this update, we included some new content addressing the role of non-operative treatment for acute uncomplicated appendicitis. And aside from the content that we developed on patient selection and who this approach might be safe to use in, we also had to think about what antibiotic recommendations we would include. And many of the trials that are out there, they were quite heterogeneous. And when they reviewed the available evidence, they found that the studies focused mainly on the comparison of outcomes between non-operative treatment and surgical management in acute uncomplicated appendicitis. But because of the heterogeneity of the studies in terms of the population, the intervention, the control, and the outcomes reported, it made it really difficult to determine what the optimal antibiotic regimen was. So the group noted that a head-to-head study comparing the clinical efficacy of different antibiotic regimens would be really beneficial in informing these new recommendations that we have. So please go and check out the evidence gaps we've published. They are freely available on our website. If you go over to our updates page, they are linked from the What's New in Antibiotic. And just finally, having lived and breathed this guideline for the last few years, and just seeing all of the work that's gone into the update from our incredibly dedicated expert group members, many of whom you've heard from today, and all the people involved at Therapeutic Guidelines as well. I'm just really thrilled to see these guidelines live. You would not believe. And we're really looking forward to people getting online, using the guidelines, and getting in touch. We always do welcome feedback. I've popped our feedback email up there if you would like to contact us that way. If you become aware of any new practice-changing evidence or other signals for change, we'd love to hear about it. So please do get in touch. And as outlined before, our work isn't done yet. We've got those 2 expert groups that are in the thick of updating their topics, and the other expert group that's nearing the final stage. So to stay abreast of when new content is released, you can also subscribe to our updates page to get notified of any future updates. Thank you.